the barriers prior to the referendum were what politicians considered to be a still visceral opposition to abortion, even though those of us who had been campaigning on pro-choice issues for many years, we knew that there had been a change, and we felt that Irish people were ready to be asked a straight question. So one of the big barriers was actually persuading the majority of our legislators that this would not be a risky thing to do, that having a referendum was a sensible thing to do, and that they were not going to lose their seats, that they were not going to be thrown out by the electorate. So that political challenge was the first challenge we had to face, and it was huge, and we did face it, and we actually succeeded in that challenge. And then your very big challenge, it's sort of ongoing all of the time, is to bring the electorate around to understanding what they actually feel, but to being able to articulate that getting your own people, your own advocates, your own activists to stick with the messaging, to sing out of the same hymn book, that's difficult. You've got to exercise great discipline on that. You can never do it perfectly.
The biggest challenge we faced is that we didn't have any public health or medical evidence or statistics other than that the women traveled. So we're unique in the world, in the sense of we have, obviously Irish women have been hugely advantaged because we're next to the UK, but that's been a massive disadvantage to us because we do have this safety valve. So we had the 5,000, 6,000, 7,000 women traveling every year, or taking in latter years on the medication from the internet. So we didn't have any difficulties or traumas or deaths or backstreet abortions or sepsis or people bleeding out. So for us, we were trying to make public health arguments based on international evidence and what happens in other countries and what would happen in Ireland if we didn't have this safety valve. And all we could do was use the statistics of women who traveled. And we did an infographic at one stage of how many women went from every county, this 26 counties, each year. And you could see the numbers changing and so on and so forth. So that people could say that Leitrim, which is a tiny county, got 100,000 people, had 26 people travel, 1 year, and 39 people. So the tiniest county in Ireland had people every year. And then because our obstetricians, gynecologists had absolutely no work or clinical experience in this area, and were really working often in big publicly funded but charity Catholic Church owned, there was a lot of gagging of their voice. So we ended up that Doctors for Choice was largely a general practitioner organization, which was great, except we did lack the expertise of obstetricians.